All right. Well, good morning, everyone. I've got 9:02. It is December 5th, Monday. And thank you guys for being here this morning. It is getting down to the nitty gritty here in December. Why we're here to improve the lives of our community with affordable health care. Thank you for being on that mission. So the mission has 3 days left of AEP, including today. We have Monday, Tuesday, and Wednesday to close up for AEP 2023. And then we're going to talk about mini lock-in here and all the opportunities that we still have to write business for Medicare and also for ACA. So we'll talk about that a little bit today, and then moving on for next week, we'll deep dive into what that looks like and getting prepared for 2023 and moving forward. I do want to remind everybody that I know this is a very, very busy week. Especially here. I know that we have low attendance today comparatively, but we are hosting these calls on YouTube. Last week we had an error glitch, so I was able to go ahead and pre-record and then load it up on YouTube. So if you missed anything from last week, you can go onto our YouTube channel and get the latest there. So the easiest way to get to our YouTube channel, just to make it as easy as possible, is I popped open the link in the chat there for you. So you're going to go to our YouTube channel, which I'm going to go ahead and share the screen here. And I'll show you exactly how to subscribe. And that way you can follow us on YouTube so there's no issues in case you miss a call, or even if you want to catch up. So this is our YouTube channel. I put the link in the chat there, but it's youtube.com/@healthplanmarketsorlando. And there, once you land on the page, it should look like this. You'll see a subscribe button there. You're going to click the subscribe button and you should be able to go ahead and get set up. Now, I'm already subscribed, so it's not going to show me that. But also what's going to pop up is a notification, which will look like a little bell here. So you're going to go ahead and click the notification. So that way, when we do have any videos that get loaded in, you'll be notified both on YouTube, and depending on how you get your notifications, you might get a pop-up on your phone, or you might get an email, depending on what you have, what settings are there, and how you want to be notified. So that way you know that there's a new weekly update available, and you can watch those at your leisure. So they're all right here. We do one every week pretty much. And so they're recorded and saved. So if you want to go back, there's a playlist here. You can go over to the playlist and you'll see weekly updates, and you can just let that roll and you'll catch up on all the great stuff that's going on at HPM. So that's what, just want to make sure that everybody knows how to do that. If you have any problems or questions on how to subscribe on YouTube, or just to get the notifications, please let us know. We are very happy to help. All right. So training this week, again, it's going to be very light because, as you know, it is a very busy week, especially Monday, Tuesday, Wednesday, with you guys closing up AEP Medicare 2023. But as a reminder, if you're looking for shop training, that is every day at 8:30. It's a pre-recorded training session. You just go in there, click the link, and you can watch the training video, which talks about the call recording and all the great stuff that's changed for 2023. Again, that's every day at 8:30. Just click that link and it's available to you. Later today, United Healthcare is doing their virtual office and chat sessions. So have any questions, or you have a situation, you can jump on there. That's at 4:00 today. And they're also hosting another one on Friday from 3 to 5. So just know that those office hours are available. And then Tuesday, tomorrow, Cigna's doing their virtual office questions and answers at 9:00. They have another session on Wednesday at 12:30. So that's pretty much everything going on. Devota's got their coffee and chat sessions on Thursdays at 11:30 as normal. But other than that, it's pretty slow. Now, with the addition of our newest team member, Al Clancy, him and I are creating a curriculum and also trainings that we're going to be building out going into 2023. Some of these will be live in person. Some of them will be hybrid, meaning that you can be online. And some of them will just be pre-recorded or webinar series as well. So those are coming. And we hope to have a few on the calendar here maybe towards the end of December, possibly soon, and then definitely in January and moving forward. So appreciate everyone's patience. But in the meantime, if you have a specific issue, or if you have any questions, or if you need a little bit of TLC or coaching, Al is available, Al Clancy. And so his email is aclancy@askhpm.com. Or just remember, you've got support and we can connect you there. I'm also putting his email in the chat here, so you guys can reach out to him directly if you do have a question there about training and all of that good stuff. Okay. All right. So let's talk about the happy hour coming up. We do have our ugly sweater contest happy hour event that's happening on December 15th. So in 10 days, we'll be getting together. It's from 4 to 7. It's a nice little happy hour at Ace Cafe downtown. If you have not yet RSVP'd, please make sure you do so. We only have about 10 spots left, and we're already getting there. So we initially had set aside about 50 spots, and so we extended it to 70, but there's still only 10 left. So if you haven't RSVP'd and you're interested in coming by on December 15th, it's a Thursday from 4 to 7. It's sponsored by WellMed. There's going to be a lot of door prizes just for coming, free food, free drinks, and prizes, contests, really fun stuff. And I heard there may be some karaoke, so bring your beautiful voices, and you can compete as a karaoke champion. So there it is. Again, just as a reminder, our our support system is also online. So remember, we have support at askhpm.com. Can't stress that enough. If you have any questions, concerns, issues, please, guys, just shoot us an email there. If you can't wait, you can call us or text us at 844-696-3975. You guys have that number. But also the chat is there. So bottom right corner, you're going to click the chat button and you'll go over to ask, and the chat feature will be available there. You can also email us from there as well. But we also have a self-service center. So if you have a question, you could type it in here, and we might already have an article available to you. So just look at that, and just want to remind you that it is there to help you. So just want to make sure that you're getting service as fast as possible, but we are here to serve you in anything that you might need. Okay. One thing that we are putting together is our events. And I bumped into a couple of agents last week that are doing events, but they haven't let us know. Number one, please make sure that you're loading those events. If you're doing it directly with the carrier, that's fine, but we would still like to know what's going on. And the reason why is because we want to help promote your events. So if you're at a Walmart or a doctor's office, or you're doing a seminar, or whatever you're doing out in the community, tabletop at a health fair, let us know. Just fill out this form. It doesn't take long, and we're going to promote it online, so social media, and on our website. Okay. But also, it's really great for us to know what's going on in case the carriers come back. If there's ever an issue or a question, we're here to support you, and we know what's going on. If you don't let us know, we can't promote your events. And then if you do get a boo-boo, we can't help you because you never told us. Okay. So please make sure that we're in the loop with events. Again, we have the form here. Again, I'll pop it in the chat for you guys. It's always available to you. You can fill out the events and make sure that you've got that. If you have a question about one of your events, or if you forgot if you loaded it or not, just shoot us an email at support@askhpm.com or give us a call. You guys know how to do that. Okay. Let's talk Jamaica. We're getting closer to the end of the contest. Now, although open enrollment is ending on Wednesday for AEP, for Medicare, there is still a lot of opportunities to continue to write business on December 8th and all the way up until December 31st. So any applications written during that time still count towards the contest, as long as they are 1/1 effectives. So all 1/1 effectives, even if you write one on December 8th and you use the Hurricane SEP, or you wrote up somebody on Medicare and Medicaid, or you wrote up somebody that's turning 65, those are still going to count for the contest for 1/1 effectives. Okay, so any 1/1 effectives all the way until 12/31. But also, as a reminder, freedom applications are now worth 3 points until the end of the month. So we started that contest last week from 11/28. until 12/31. We have boosted points to freedom from 2 points to 3 points. So any business that you've written between 11/28 to 12/31 for freedom will go towards your points. Here is the contest page. Again, I'll put this in the link here in the chat. You guys can get directly to it. But congratulations to Mark Oster. He's doing a fantastic job. He is on his way to 150. I don't know if he'll hit it, but maybe there's a lot of room to do so, especially if you write some freedom apps. He can definitely get to 150 for that suite. But congratulations to you guys here. I'm not going to list everybody, but really great job on everybody that's made it. I am concerned with those folks that are sitting at the 47 mark, 46, 43. Come on, guys. Maria, I think you could do it. Gail, definitely. Stan, come on, buddy. I know you can get there. You're at 43 points. Sandra, Liz Caballero, Liz Courtney, you guys are all very capable of adding those. Some of you need, just 3 points. Some of you need 10. But depending on how you cut that up, if you're looking at freedom specifically, to get 10 points, you need 4 applications. If you're writing 1-point plans, you're getting 10. You got to write 10 of them, right? That's a lot. But look at your scale and see if you can get there, guys. We'd love to have you. This is probably going to be our biggest trip that we've ever done, and I'm very excited about that. The more, the merrier for us. We want to have a great time, and we want to invite everybody to Jamaica, and we're going to have a fantastic time in April. So keep that on your fridge or wherever you are. We want to make sure that you get to that contest. All right. I want to jump over to talking about healthcare.gov for a moment. As you know, we're in open enrollment for healthcare.gov, and it's going on right now. Just remember that for 1/1 effectives, we got until December 15th to get them enrolled, to make sure that they're eligible for 1/1. One thing I do want to share with you is the federal poverty level has been updated. So there is a chart here. This lives in our gold key, but I'm going to give you the link directly to this page. This is our healthcare.gov frequently asked questions. A lot of you may be getting emails from healthcare.gov and might not be reading them because they're maybe not relevant to you right now. But what we've done is we've captured pretty much that content and the content of those emails, and we're saving them here. So for instance, there was an email that says tips for helping consumers reduce potential out-of-pocket costs. And I captured that there. There's some links and slides and videos and stuff that you can use, that is available here too. But talking about the FPL, you have the reference chart at your fingertips here. We did load that in. So from 2022 moving into 2023, household size of 1 is still at 13,590. But again, depending on how big your household is, you can earn as potentially up to $186,000 and still qualify for assistance on the marketplace. So this is just a great little guide and resource for you guys to have in case you have any questions about. And here's a reference guide on documents, on what the documents that you need, where are the numbers that can be found when your questions are being asked on the application for your members. So that is there, and healthcare.gov. Lots of different links and things that you might need there, but the FPL has been loaded in there, so you have it now, so you can see exactly what the numbers are and what that looks like. Okay, want to share with you a couple of special assistance programs. Some of you have been, working with the low-income folks, or maybe helping some of your clients apply for Medicaid. Some of you have helped apply for LIS. But there's some other programs out there that you might want to be aware of. One of them is the prescription patient assistance programs that are out there. Usually they're by the actual drug company or the actual drug itself. It's actually very interesting because some of these drugs have their own websites. So if you see a commercial for a drug, they probably have a website just for that drug. It's pretty amazing. But one thing that did pop up, and thank you to Liz for sharing this, Liz Caballero, appreciate it. There is a Tradjenta patient assistance program, and I found a an application here. Liz was saying that she's bumped into a lot of folks that have type 2 diabetes. And so these folks are taking a very expensive drug, which is usually a non-preferred drug in the formularies across all the plans, called Tradjenta. And so if any of your members are taking this and they're struggling with those costs, they can apply for this particular program. One thing that Liz did mention is they do have to make less than 250% of that FPL. So remember, I just shared with you what is the FPL. So at 250%, and they do have to fill out the application before they hit the gap. So right now, December, January is a great time because it's about to reset on January 1st. Okay. But they can do the application themselves, or you can help them. There's an online form, or they can call the number and get that done. They're usually pretty responsive, 24-hour response time, and they let you know if they qualify. So you can apply now. You just click the button there and apply. This is through Simple Fill. So this is just one of the prescription drug programs that are out there that you can use to help your members. And so look online. If one of your members is mentioning a non-preferred drug that's really, really expensive, and you're looking through all the formularies using Medicare Shop's coming back and saying, hey, sorry, these are the best plans, but the drugs are still expensive, then you've got a couple of options, right? And as a reminder, we want to roll through, what do I do for my members if there's a drug cost? They're coming to you with a problem, right? If you're not solving those problems, they're going to try to find somebody that does. So typically, for your sake, obviously, you want to do your due diligence in trying to make sure that you're helping them with their medication costs. One thing is talk to their doctor. If there is a generic available or an alternative that's less expensive, the person to do that is their doctor. So that's probably step number one. Step number two is ask the doctor for samples. These doctors are given boatloads of samples, and they have to give them away. They can't sit on them, right? They're not making money from them. They're not supposed to sell them. I don't know if they do or not, but they're not supposed to do that. And they're supposed to give them away. So if the patient is asking for samples, that will reduce their cost as well. And then you've got these prescription drug programs that they can apply for and get additional assistance. Now, if they qualify for LIS or Medicaid, that's another way to help them with their costs. Specifically LIS. LIS is the program that helps them with their medication costs, and that would help them. But if all else fails, you can go shopping for a new health plan. So, that's what you want to roll through your mind when you're talking to a member. What can I do? What are the steps that are available to me to reduce my prescription drug cost? Even if you save $10 for the member, that's $120 a year. If you're doing that monthly, sometimes they're picking it up more than once a month. Maybe they have to go to the pharmacy twice a week or twice a month. Sometimes it does happen because they have these very, very expensive drugs, so they have to get them in pieces and parts. So changing pharmacy is another way. Moving to mail order service is another way to save on your prescription drug services. So, pay attention to that. Listen to your members. These are just some great ways to help save them on some prescription drug coverage. And that talks about, talking about this very quickly. And then we're going to move into the next assistance program here, which is kind of in a different gear. But if you become an advocate for your members, if you become an advocate for the community, and you're no longer a health insurance agent, because they could smell it on you if you're going in there, right? You're not a health insurance agent anymore. You are a patient advocate. You are here to help people with programs that are out there that are free programs to help them in their community. You guys can be the highest paid volunteers in the world if you do this right. This was one of the ways that I did my sales when I was an agent. I wouldn't go in anywhere and say, "Hi, I'm Justin, and I work for XYZ company, and I sell Medicare." They're gonna say, "Thanks for visiting," right? That's not how you're approaching these places. Okay, you can get into some great places if you just take off that hat and you put on the hat that says, I'm a patient advocate. I am here to help our community with services that can help them save money. Okay, whether it's medications or what I'm about to show you right now, which is called the Affordable Connectivity Program. And thank you to Kelly Harrington for sharing this with us. The Affordable connectivity program is a U.S. government program run by the FCC to help low-income households pay for internet service and connected devices for laptops or tablets. So, the federal government has found that low-income individuals struggle with internet connection or struggle with having access to information because it's expensive. I don't know about you guys, but internet, just to have a video connection in your house is, about $100 just for the internet service. So, for somebody that's on a fixed income or a low income, that's expensive. That's very expensive. So this program gives them sometimes up to a $30 monthly discount on their internet service, which is significant. They can even give you $100 towards a laptop, tablet, or computer, which is really cool. And then you get a low-cost service plan that's available through the ACP. Okay, so this is another program that's available to help people get online, stay online, get a tablet or a laptop or whatever it is in their home so they have access to information so they can apply for programs and things like that. So if you're out in the community and you're setting up a table and you have any signage or you're letting people know, hey, I'm here to help people get internet connection at a discount, for people if you have Medicaid. And what ends up happening is people come up to you and they say, yeah, I'm interested. I have Medicaid. And then they pull out their Medicare card, or you see that they have a Medicare card. And you're like, oh, you have Medicare. So then you obviously you help them apply for this and you shift gears and you say, how is your health care working? I can also help you with your health care. And then you start that conversation. You get a permission to contact, or if you're at your event, you can go ahead and use your Spark CRM to collect that consent to contact, get the scope of appointment, do all that good stuff. But that's how you do it, guys. So from December 8th until December 31st, if you're out in the community, which is a really great way to stay in front of folks now. Remember, it's the holiday season. And there's a lot of people hurting. Inflation is here. The price of food has gone up. And, for a lot of people that are on fixed incomes, their check doesn't hit until January. A lot of these people are getting a little bit more money. But that doesn't start until January, and their checks come in around the 3rd, 5th, somewhere in there. And, that's hard for people. So if you're out there and you're doing some good faith community service, letting them know, like, hey, these are some programs, and you're no longer the health insurance guy or gal. You're not the Medicare girl. You are a patient advocate. You are a community advocate. Go out there, and there are so many things you can do. And Sergio, thank you for sharing that. There's another website called BenefitsCheckup.org. And I'm going to show you that as well. This is kind of like the one-stop shop, right? So this is, there are the programs that I shared with you, and you can go direct there. But BenefitsCheckup.org, and Sergio put it in the chat, is run by the National Council on Aging. So this is an official program. And this is a one-stop shop. You could help veterans. You can help people with education, food, all sorts of great stuff is all baked into this one website. And so here it is. You can scroll down. You can do the application here. The first thing that they ask you is for your zip code. I'm going to show you how easy it is. You can do this over the phone too. I think this is a fantastic program for if you wanted referrals, if all you did was call every single one of your members and ask them if they knew anyone that needed extra help around the holidays, you can help them apply for some key programs. Okay. And here's some key programs here. Healthcare, obviously, that's your wheelhouse. Medicaid, LIS, no surprise there. But what about food and nutrition? What about SNAP program? What about housing and utilities? Section 8, the Lifeline program, which gives them a phone in their house too, right? LIHEAP, which is for their energy bill, supplemental income. All of that is available just through this website. There's also some prescription stuff too. And if you need some more information on some of these programs, you can just go through it. And it's a very simple, very clean. Actually, they redid this. It's nice and beautiful now. the application process looks really, really nice. And, just click and go through it. But if all you did is call each one of your members, and you might be surprised, maybe one of your members you never thought would qualify for some of these programs are saying, yeah, actually, I need a little bit of help. Okay. Um, but if they say, yeah, actually, my neighbor across the street, or my cousin, my uncle, my brother, my former roommate, whatever, this program right here will generate referrals for you. People will call you and say, hey, I actually need help. My neighbor told me that you can help me apply. And then, once you get through that healthcare piece, you say, hey, well, I can help you with healthcare too. And that's how some of these folks are generating consistent sales month in and month out, staying in the leaders board, getting 10, 15 sales a month. Why? Because they've built their pipeline. They've continued to market themselves, not as just a health insurance person, but as a patient advocate, as a client advocate. And that's part of your job. Now, if you're trying to take the easy way out and say, I don't want to do any of this, it's too much work, I don't get paid for this. Yeah, that's true. You're not going to get paid for this stuff. But if you want referrals, if you want your phone to ring, then you got to get your hands dirty. You got to get your hands dirty. You got to go out in the community, and you got to show people what you can do. Okay. If you're sitting at home, one of my favorite sayings, if you're sitting at home and you're expecting them to walk through your living room, it ain't going to happen. Okay. Your leads are not going to walk through your living room. If all you do is call your members, right after December 8th, there's two reasons you want to call your members. Number one, you want to make sure that they've got everything they need. And that they're properly enrolled. They're starting to get their cards now. They're starting to get their packages. Did you get your package? If not, you can go ahead and do that. You can help them set their first doctor appointment. Hopefully you did that in the front end so you can get compensated by one of the provider groups that are doing that. But this is a great way to help them set up their appointments. And then you're going to ask for referrals, guys. Ask for referrals. Now, we do have a Hurricane SEP. Okay, AEP ends on Wednesday. That is official. It's not being extended. That's not a thing. Okay, AEP ends on December 7th. On Wednesday, it's over. If you're using Medicare Shop, you can write business all the way up until midnight. Okay. If you're doing a paper app for whatever reason, you got to turn it in the next day. So, don't delay on that. But just remember that on December 8th, we have mini lock-in from December 8th to December 31st. What should you be doing during that time? If you've written a lot of business, if you've written a significant amount of business, you should be calling your members saying Merry Christmas, Happy New Year's, Happy Holidays, Happy Hanukkah, whatever it is. Thank you for being a member with me. Did you get your cards? Did you get everything that you needed? Do you have any questions? Great. I want to let you know that I can help people apply for some extra help. Have them call me, and I'm able to help you. Oh, and by the way, do you know anyone else that might need my service? Okay. If you do that, if you really, truly, honestly do that, I will guarantee you will have leads and sales to supplement your January 1st effectives. But I know 80% of you on this call will not even do that. Okay. Do it. Do it. Take the time, sit down, organize your book of business, go back through everything that you did this week. Check your applications, make sure that they all went through properly. Those of you that are using Medicare Shop, you don't have to do that. You're done. We got a confirmation number. And Jonathan has confirmed 99% of our applications have been processed. We only had one issue, some glitch in the system on the carrier side, not even on our side. But all of the applications have been processed. You get a confirmation number at the end. So if you're using Medicare Shop, you're done. You don't have to do any of that. Relax, put your feet up. Do that for December 8th. And then December 9th, hit the phones again. Start calling your members, checking in with them, and doing your due diligence. If you do that, if you call your members from December 8th to December 31st, and that is all you do, I guarantee you will have some extra Christmas money to spend, extra travel money, and all that good stuff, and gearing in for January 1st effective. The other reminder that I want to make before we end the call is I know many of you did not complete HRA forms for some of your applications. Some carriers still have a window for you to go back and complete your HRA forms, and that will live on Medicare Shop. It'll show you which ones you can go ahead and do. Some of them are going to be expired, but certain carriers like Humana, you can go back and get your HRA forms done. And that's an additional amount of money that you get in your commission. So this is a great time to start doing that this week as well. Okay. If you guys need any help with this, if you have any questions about this strategy, please let me know. We're going to be putting on a training as well and some great videos to share with you on exactly what you need to do and how you need to do it. We want you guys to be successful because without your success, there's no success for any of us, right? Including your members and the community. So we want to help them. All right. So there is a question here. So if someone makes a change using AEP but decides that they want another plan, can they use SEP FEMA to change? Okay, so the plan hasn't gone into effect. I'm assuming this is for a 1/1 effective. So they use AEP, they enrolled. It's December 9th now. They call you and they say, yeah, Justin, you know, I'm really not, I don't think I want this plan. There's two things you can do. Number one, the plan has not become effective yet. So you can actually disenroll them. Okay. The member would have to call the health plan to cancel their application. It's called an early cancellation. So they can cancel that. And so that would mute that AEP enrollment. But let's say that they already got their package, they've been enrolled, quote unquote, you know, they're set up for 1/1 effective. Can they use an SEP to change? The answer is yes, they can. So if they're using FEMA or hurricane, whatever that is a separate election period, and they can use it. Now, the question about the hurricane specifically, though, is that the hurricane SEP is only for those people that did not make a selection in AEP and they missed it because the hurricane affected them. Okay. They lost power, they lost water, the roof came off, whatever it is, that particular SEP, they must not have made a selection during AEP, and they have to use that SEP there. Okay, so keep that in mind. That's specifically for the hurricane. But if they have another SEP, such as Medicaid, LIS, you help them apply for this program and they got approved. They just moved. Or they just turned 65 or whatever. There's a lot of different SEPs available during this time. And so during that time, you can go ahead and do that as well. Now, Kelly's reminding us that OEP, you can also use OEP. OEP does not start until January 1st. So we do have to wait for OEP. But January 1st, we're going to go through OEP. And that lasts till March 31st. We're going to talk about that. But next week, we'll deep dive a little bit on what we need to be doing for this mini lock-in from December 8th to December 31st. There's still work to be done. I know it's the holidays. I know you guys are probably exhausted. But this is an opportunity for you to continue to grow your business and have a really great start for 2023. Okay, that's it for me today. I want to thank everyone for being on the call. Really appreciate it. As a reminder, these calls are being recorded on YouTube. Don't forget to go out there and subscribe, and we'll get you taken care of. Thanks everyone, and have a fantastic close of AEP.